From World Gynecologic Oncology Day, and today we have a really fun interview planned with ESGO President Dr. Jalid Sehouli. So I'm just going to bring him on the line. I hope that everybody is having a great start. The end of June even. It's been very exciting that we have a lot of events being planned on our website. All right, and we are here. Thank you so much.
Hi, we made it.
Professor Sehouli, thank you so much for taking time to talk to us again. I think the last time we spoke on the Instagram Live was a year ago, exactly a year ago here. So we're so pleased to have you again. So for anyone who is tuning in, Professor Sehouli is the president of the European Society of Gynecological Oncology. You can see the logo behind him, very nice. And World Gynecologic Oncology Day, which I represent, is Awareness Day for Gynecological Cancers that is started by the patient network of ESGO. So World Go Day and ESGO are very closely combined, and we're so happy to have your support for our awareness campaigns. You are a very big proponent of awareness. I always love watching in May, you and the local patient advocacy groups go through Berlin, where you're based, with a big parade for ovarian cancer awareness. Can you tell me about that event? It's so fun.
Yes, so first of all, thank you very much for your outstanding engagement, because I think patient empowerment is one of the key driver to preserve and to get quality in diagnostic treatment in cancer care. And we need your inspiration. So I really love it. Yes. So the World Ovarian Cancer Day is a political action because I introduced the Ovarian Cancer Foundation 20 years ago because I have seen that many patients are stigmatized in cancer, and I think that will be maybe even a topic today. And
Sure.
We need to go to the street. If the street doesn't come to you, you have to go to the street. And I think medicine,
Literally.
even as a doctor, as a researcher, I'm responsible that I reach the community, I reach the patients, and have not to wait. And I think it's so important to make these topics visible for everybody, for the civil society, but even for the politician, and to bring the patient's voice and the patient's perspective to our community. And this is the reason every year we do this World Ovarian Cancer Day. And I'm so proud. It's becoming bigger and bigger, and
Yes.
It's really wonderful.
That's great. I mean, speaking of, stigma and taking things to the street, I mean, gynecological cancers still, I mean, even 20 years ago you started, but still gynecological cancers are not discussed enough. What do you have to say about that? Like, how can we change it?
Yes, I think it's very important that knowledge is overwhelming, but nevertheless, in many decision makers, they believe ovarian cancer or other cancers, even if they are early or advanced diseases, have no treatment options, and there's no treatment for survival. It makes no sense. So it's really a question of knowledge. And the second is it's a question of attitude. That minimal support is there. So I think we have to strengthen our stakeholders and to work as an alliance. And I think this is wonderful. And I'm so proud to be the ESGO president, that in a line with patients, advocates, young doctors, and experienced experts, we are in the same direction. And I think this makes a difference.
Yeah, it's really nice to see how many people come together every year for cancer awareness, for the individual cancers in ovarian cancer, endometrial cancer. And then we have, of course, World Gynecologic Oncology Day, which takes place every September 20th. And when we're talking about policymakers and politicians and these decision makers, how do we best get their attention? I mean, talking on social media does a lot. But what else do you have in store? What do you have planned?
First of all, we have not always to blame the politician. The second is we have to blame ourselves. Because if we have not a clear message how they can understand. And if we are not running as an alliance, as a group, then the voice is quite low. So this is, I think, the first step, that we are understanding that even if we have high research results, to translate the message in an understandable language, and even to think about demanding, but also at the same time to think what can be the solution. Because at the end of the day, it's our work that to solve the problems. And I think this was even in doctors' communities ignored for many years. So this is the first step. The second step, communication must be clear. It must be sustainable. So it's not enough to make one campaign. That's the reason World Go is every year. It's a stone by stone evolution. And the second is to think how we can strengthen our outreach. So work with media, work with politicians. To change politicians, we need a majority, we need a big noise, and we need relationship to them. So that's the reason why we asked to create programs for legacy. That's the reason why ASGO switched from Switzerland to Brussels, because it's not a German topic. It's a European, it's a global topic, and that's the reason we have to go directly where they make the law. But it's not simple, because it's time consuming. It's even they are trained to talk, and they are not trained to solve problems. And some of them, they think about only 1, 2, or 4 years. But some politician with a good heart, and we have to identify them, and we have to strengthen them. And this is something what I think is really crucial, to have a clear message and to bring alliances, and even to show what can be the solutions.
Right. I mean, so do you have any advice for? I mean, we have some doctors here who are whose names I recognize. We have Dr. Nagham, we have Dr. Ahmed here. We have I think some people also, Miss Turtle Doc. I'm not sure. Romaise, Fritz. Thank you, everybody who has come on and said hello and waved at us. But do you have any advice, Professor Sehouli, for doctors who know that they need to join their voice to make this noise, but they're not sure where to start? Maybe they're shy, they're not comfortable, maybe talking like this on Instagram. How can they join? I mean, joining ASGO is a big start, right?
Yes, it's a big milestone to enter ASGO and to look to got experiences to understand the system, because healthcare system is very complicated, and I'm now 30 years in the field and I'm still learning. But you have to know how politicians are working, how the insurance companies are working, how all the hospitals and the private practices are working, and even to understand that the elements to change the system are very, very colorful. But first of all, even to understand how to speak with politicians. This is something different. It's different to talk with a patient. So, but again, you have to be very clear and to make simple messages. So if you as a researcher say it can be, I cannot exclude, there's not enough evidence, so don't show any leakages and weaknesses. So it must be very clear but honest, and even to think how I can got the majority of a party, of a group. And that's the reason I think it's a time evolutional topic, but it's wonderful, because again, if I do science, it's good to have individual experience, but to bring it in a European level or a global level, that's different. And this makes the differences. So if you make a diagnostic standard operating procedure, it's nice to have it for your environment, but to make it as a European guideline or a global guideline, even to translate this to regions with limited resources, it's wonderful. And this opportunity ASGO is giving to you.
Yeah, and so you're referencing, I think, the resource stratified guidelines
Yeah.
projects, right? Which can you remind our audience what that's about in case they don't know?
Yes. So first of all, if you think about guidelines, so the backbone of guidelines are generally evidence-based medicine trials, so randomized phase 3 trials from Europe, from US, or from Asia. Okay. But then it will be translated in regions where have maybe no access. So how to prioritize and how to adapt without compromising efficacy, because some treatments are a can, some of them are a should, and some of them are a must. And this is something what I think even in Western countries, whatever it means, would help to give patients opportunities, but even to work together to have more access for every patient, because that's not true. Even here in Berlin, one of the richest city in the world, there are several patients and women, they have not access to the best quality of diagnostic, the best quality of treatment or cancer care. And this is sometimes happen associated regarding financial, educational, and sometimes even by the institutional dependent way. So I think this is something what we have to understand, and that's wonderful because we are citizens and we need to be much more global as a world citizen, because if you look on war and all the attacks we see every day, it's horrible. So let's mix it, because if you talk about fear in a woman with cancer, you cannot ignore the fear of losing her partnership, losing her job or her relationship, or her fear against war or other diseases.
Yes, I mean, doing this series of interviews, I've had the privilege to speak with patients and doctors from around the world, and it's amazing to see the different struggles that people have. Every
Yes.
region is unique, so it's very nice to be able to provide something so that at least there's one thing that they don't have to think about that way. You've said a couple times, women's health is global health.
Yes.
How do we approach global health in a way where everything is so divided with resources or a training?
I think it's very important that we understand that if we talk about climate, it's global. If we talk about education, it's global. If you talk about migration, it's global. So if you think about health, it's global always, because health is defined according to the definition of WHO as globally, physically, mentally, and socially well-being. So this is the core definition of health. So, and what I want to see is, again, that women live long everywhere. And if we talk about women health, we know that many things are not adapted to women health. And we know that women health is the quality indicator for every healthcare system. But it's a shame that many governments, even in Europe, have not addressed this in their protocols. So how you talk about diversity if you ignore women health? So women health is one of the backbones to touch global health. And if you talk about treatments, and they're first approved in US, or the drug is developed in China.
Yeah.
And we do trials even cross-continental. So at the end of the day, every individual medical procedure is linked to global health.
Yep. It's fun if you start looking at the pieces, right? And where all the
Yes.
threads go everywhere. Drilling kind of zooming in, I guess, to something that you mentioned. If you are a woman in Berlin right now, and you maybe don't have the privilege of an education that might help you, and you receive an ovarian cancer diagnosis, what can you do? Like, how do you talk to the doctor in this sort of situation? I mean, we're one of our campaign themes this year is about supporting patients. And it's hard to understand where to begin with that for some populations.
Absolutely. So I think first of all, we have to accept that so far, even from the advocates, but even from the medical professions, that we don't reach every woman. So, and there are different reasons maybe. So it can be the comorbidity, the frailty of the patient because she is too sick. The second is that we maybe exclude them by our materials. Yeah. So think about the wonderful materials we have from Engage and even from other institutions, but generally they only in few languages. And then if you translate it, it's even not the same because you need to adapt to intercultural. Some of them are more trained to listen or to watch by visual. So it's very important to understand that every individual have a different idea, and we have not to go too early in stereotyping the patient. So even migration, what means migration? It's first generation, second generation, third generation. We know that migration is not an independent factor to have access to medicine. It's more the education and the experiences and even the economic environment. But nevertheless, it's important. What we do now in next week at Charity, we have a session for patients and relatives and for NGOs, and we make it in German, in English, in Arabic, in Russian, and in many other languages at the same time using digital solutions. Then we even doing podcasts for patients to reach them. So because if you do always the same materials in a copy, it's not enough. So these are formats, and what we just started to develop at Charity specific videos and movies for patients. And what we did, we incorporated them from the beginning, because if you develop materials for the target, then you have to use the target from the beginning. And that's what we do by ASGO. So no guideline without patient advocates, but even no campaign without asking them.
Right.
And to look, because it's sometimes our fault that we think what is good for patients, but we never ask the patients, and that's the same. So, and even for the trials, if we think about exclusion criteria, you must decrease the level, the barriers. So it should be accepted even if you have comorbidities or second diseases, because there's enough evidence that it's not inferior. So this is something, but what is important and what you use, social media is important. So why not to dance in TikTok, to talk about clinical trials, whatever it means. At the end of the day, I want to reach as many women I can. So think about the channel they use and try to use them to interact, to create trust, and to invite the people for a personal meeting.
Right, and that creating that trust is so hard to catch if you don't have the patient involvement, right? We have a comment here from someone who's watching, from Miss Turtle Doc, who is a GP. She wrote earlier in the comments, she says, so true about politics and deficiencies in women's health, even in Europe. I'm in the UK. Primary care is the first contact for women here, and we are very overwhelmed by patient demand in general. Do you think that that's similar in Germany?
Absolutely, yes. I'm even very proud. Even the colleagues from UK, they started very early to reach even the community. This is something what, for instance, in Germany, but even many other countries have not done so early. But again, there's always space to improve it.
Yep, for sure. Well, thank you for the comment. If anybody else has a comment, please feel free to ask it down below. We're going to get some. Okay, can you see? Okay, something just went here. Good. All right. So this year's campaign theme, as I mentioned, was support, not stigma. And I think you kind of covered this a little bit already, but what specific advice might you have for our younger doctors, the Inigo fellows who have sometimes take part in these calls as well. For when they're starting their career, they want to get the noise out, like you're talking about. They want to support patients, but what's the first thing that they need to remind themselves?
So first of all, learn to listen and learn to watch. Because if I was a young doctor, I entered an advocacy society, and I was really impressed by their knowledge and even how they are even experienced how to deal in the system. And first of all, even you are studied medicine, in some areas, patient can be much more competent than a doctor, and that's fine. So first of thing is to understand and to listen to the people. This is something, I don't know if you know Momo. It's a very famous story in Germany. Momo, he was always got secrets from the people, despite the fact he know nothing, but he understood to listen to the people. So listening is one of the key. The second is even to be in the system, to understand how to develop webinars, how to develop materials. So if I was a young doctor, I introduced the first ovarian cancer brochure in the world. It was 2006. I did my first brochure. And then I even started to translate, and I understood how difficult it is to translate, and even so experience. This is the same what you do with surgeries. If you want to become a good surgeon, you have to see many surgeries, and you have to see good surgeries and bad surgeries. And you need some support to reflect the quality and even to develop in the next level. So if I was in the advocacy, I have listening to the patients and looked how they do, what are the demands, and then we started together. And at the end of the day, it's an alliance.
We have a
co-scientist for me, and even co-leads. And it's easy. It's even not weaken and will not break your competence, and even not your hierarchy. It's not. It's even vice versa. It will grow because everybody expects that you are trained. But what they are not expecting, that you are listening and that you gain together new knowledges and to change the behavior. So this is wonderful.
Right. Yeah. Doctors aren't expected to be, the end of the learning, right?
Yes,
that's just the start. We have some more people to say hello to. Hello, Anton, MAJ Zoen, Doro Sroka, Vikash.
Murat
Murat Tekken, hello, friend of the channel. He is one of the very first founders of World Gynecologic Oncology Day.
Absolutely.
Thanks for stopping by.
Hoş geldiniz.
Yeah. Does anyone who's watching have any more questions for Professor Sehouli? Please ask them in the comments. Otherwise, I will keep asking him to talk. All right. We touched a little bit on this before. You mentioned, that to get attention for politicians, we have to have simple messages. We have to have, we can't be confusing that. I wanted to draw attention to one really amazing piece of news out of the UK today, which I hope is going to cause a lot more awareness about gynecological cancers. And that is the fact that cervical cancer has had some amazing results due to the HPV vaccine. Can you talk about that a little?
Yes, it's a shame that a cancer what we can prevent, that we not prevent. And that's vaccination and even to stop smoking are the best approaches to prevent many cancers. But this is something that's wonderful because the knowledge is clear. But to see that's a second country now, to see in the specific age that we have no new cancer. And if you, like me, knows how aggressive even our treatment is, whatever we say, it's aggressive for the quality of life, for the pelvic, for the whole woman. And if I can prevent one cases, it's wonderful. And again, I love it. I have to blame again ourselves, even the system, because prevention is not really introduced in our healthcare system. It's still triggered by repairing diseases. And prevention, vaccination, identification, screening are the most effective strategies. And this is what I really love. And even it's a wonderful news, but we have to take this knowledge. So it's not the question of knowledge. It's more the question of translation and prioritization of a healthcare system. Do we as a society in Europe, do we like to prevent the cancer or not? And if we say yes, there's no doubt that 70 cancer has to disappear according the elimination program of the global WHO.
That's right. Thank you. I was just so excited to see that news today because I was talking to you today, and then next week I'm also have an interview with a cervical cancer survivor from the U.S. So I'm excited to hear her reaction to that as well. That's going to be Samantha Gonzalez Russell next Monday. So, Professor Sehouli, we are almost out of time. I just wanted to say thank you again for coming on, for talking to us, for raising awareness about these cancers. Do you have any final thoughts about any of these things that we've talked about, or perhaps something else?
Yeah, so first of all, I want to thank you personally, because again, amazing. How is your smile and your eyes? I love it because it's not only one day, it's all the days and all the nights maybe that you are dedicated to empower women to share and to be respectful in bringing this message to the community, to us, to our patients. So I love it. And again, it's wonderful, and it should be a structure of every medical institution. And so this is really, really wonderful. So now I want only to give you still hope that we together can really make the differences in the care. So I know there are big leakages. I know that we have limited resources. And I know that the demands to have more time, more opportunities is huge. And this is our motivation from ASGO in all our groups and all our committees, yes. And what I want only to bring to you that we will change the system, but it's step by step. And we need even your support to make it louder. And what we even want to understand, that quality of life is no doubt important, but go in your sight, go in your soul, in your brain, define for yourself what you mean with quality of life. Second is, ask the doctors, if they give you a recommendation, ask them what are the opportunities and what is the evidence behind. Is it survival? Is it response? Is it quality of life? And what is the time toxicity for me as a patient, for my relatives, for my kids, whatever? So this is something what is missing in the system, to show patients all opportunities. And this is what I try as a president even to bring up, time toxicity, and that we have a much more transparent shared decision-making process, because at the end of the day, it's your life, and you have to dominate the direction of the treatment. Cannot the doctors who talk about your quality of life, it's you. But you have to provocate the doctors that they even open the hands, open the file, and if they don't know, to give opportunities for a second opinion, because quality of life, but quality of treatments is not equal everywhere. So if you are in a doctor who knows everything and have no other opportunities, so this is not my vision of medicine. So you have to change, work for ASGO and engage. And again, thank you very much for your personal engagement for this.
Thank you. I think that's a really powerful statement. If your doctor knows everything, find a new doctor. All right. Thanks again. This has been such a nice pleasure on a Monday afternoon. Everybody, if you have questions for Dr. Sehouli, for Professor Sehouli, you can ask them also in the comments of this video, and I will ask him to answer them later too. So have a great day, everyone, and thanks again. Take care. Bye.
Bye-bye.